can have a capsular space which is free, but then you can have overriding muscular tightness that causes your workspace to falter, or there might be habitual patterns that have been developed that might make your workspace falter. And that's why there's more to this system than just watching people do circles. When we do circles, there's a sequence of events. When we see something's wrong, we first go to the capsule, because we know if there's something wrong there, no matter what you do out here, it's not going to fix it. So let's say that you have restricted capsule in your glenohumeral joint, and you also have generalized muscular tightness in and around the shoulder, which is what I would expect. You can't ignore the fact that your shoulder can't move independently and start to treat these muscles hoping that your workspace will improve. It doesn't work that way, because even if you relax the overlying musculature, when you go to move the shoulder that you don't have, that shoulder will signal to your brain that there's something that doesn't work well. And then when something doesn't work well, your brain sends back a signal telling the surrounding musculature to tighten up. That's actually a direct thing that we know about in the literature. So if I give you a central nervous system here, and then I'll give you, let's say, a joint capsule there, and then we have, let's call it an overlying muscle here. Okay. If you take proprioception from a muscle, if you take proprioception from a tendon, if you take proprioception from a ligament, what happens is the signal goes to the spinal cord. And then at the spinal cord level, and I'll just blow that up here, at the spinal cord level, the signal that comes in synapses with what we call an interneuron in the spinal cord. That interneuron then decides what to do with that signal. So if the signal coming from the muscle is pain, then the interneuron will relay it to the spinal thalamic tracts, and then it'll start to send the signal up to the thalamus and the surrounding areas. It will also reflexively cause that muscle to tighten because it's a pain signal. So that little relay, it might only take a few milliseconds, but it's delayed. So in other words, all information coming from your receptors, once it gets to the spinal cord, there is a slight delay in the spinal cord where a decision is made. Do I have to kick this up to the central nervous system, or can I simply use a reflex to handle the problem? That decision takes time. However, the literature also tells us that there's one particular tissue where there is no delay, and that specific tissue is your joint capsule. So from your joint capsule, there's something called type 2 afferents. And these type 2 afferent signals, when they send information to the spinal cord, they actually end up bypassing the interneuron, and they go directly up to the cerebellum as well as to the thalamus. And then from the thalamus, it goes directly into the proper areas of the cortex. So what did we learn? We learned that there's fundamental information located or being generated from the proprioceptors in this capsule that your awareness deems more important than any of these other tissues. The capsule is the first layer of tissue that any movement is going to activate. So as soon as you move, if you take two bones and you move them a millimeter, the overlying muscles don't feel that yet. The first thing to feel the motion is always going to be the capsule. So now we have two bits of information. Number one, when a motion occurs, the first feeling of motion is going to be in the capsule. And number two, the capsule's information seems to be of higher importance to our central nervous system. Why is that? Because based on the capsule signal, the central nervous system then decides how to set the tone of the muscles. That's important. So let's say, for example, we have a shoulder where I look at your workspace, the workspace is not good. Then I look specifically at your capsular space, and for the shoulder we use internal rotation. internal rotation is the first thing you lose when you have shoulder problems. It's the capsular pattern of the shoulder. So if I have internal rotation that's severely blocked, what I'm saying is there's not enough space in this capsule to allow proper coupling between these two bones. If that's the case, if there's a problem in the mechanics, problem in the space, pain in the capsule, that signal gets sent to the brain saying something's wrong. Brain sends signal down saying protect that area, tighten up all these muscles. And here's where people go wrong. You go to a therapist of any kind, soft tissue therapist. The soft tissue therapist goes, wow, your infraspinatus is tight. Wow, your supraspinatus, your pec, your rotator cuff is tight. I have an idea, let's just rub them. Okay, now follow me. So you go ahead and you rub supraspinatus, infraspinatus, the areas. When you rub something called touch-induced analgesia ensues. If something hurts here, if I go like this, it's gonna feel better, right? The pain levels will go down. So you start to rub this muscle and that muscle because you feel they're tight, okay? You make them feel better, pain goes down, the body temporarily allows those muscles to relax. And then the day later, the person goes, I woke up the next morning after my massage, oh, I was tight again. And they say, oh, maybe you need to massage the muscles more. 2 days later, oh, I'm tight again. Go for another one. 3 days, oh, I'm tight again. So then you start to have this game where the therapist goes, you just have to keep coming back to me so I can constantly relax your muscles, which really is not the point of a therapist. The point of a therapist is more to find the problem and fix it. So what these people are doing wrong is they're hitting the wrong target. You can rub this muscle as much as you want. You can break up scar tissue, whatever it is you think you're doing, all you want. As soon as you move the joint that muscle surrounds, if that capsule doesn't display enough space for proper coupling, if there's any pain, if there's anything wrong at that level, signal gets fired, response tightens that muscle back up again. And then people just get into this dance where what they should be doing is working from the inside out. If that doesn't have space, all of the rest of this stuff is symptomatic at best with regards to treatments. So this all comes back to cars. So once again, you bring me a person with this shoulder pain, all of this stuff happens. If you show me this, if you show me the fact that I can't move this bone relative to that bone, all of the other findings are superfluous findings. You have impingement of your supraspinatus. You have a bursitis problem. You have trigger points in your infraspinatus. You have all of these things could definitely be the result of the fact that you don't really have a joint. And what I mean by you don't have a joint, you don't have enough space for this bone to move relative to this bone. And I'll tell you, if you want the easiest definition of a joint, think about it as the space between two bones. This is a synovial joint, of course. The space between two bones is your joint. That's what allows that bone to move relative to that bone. If there's no space between this joint and this bone can't move relative to this bone, then you no longer have a joint. And if you don't have a joint, giving you exercises to perform with that joint are not going to go well. So you give me a professional athlete, and instead of doing, snatches and overhead presses and all of this, what people deem to be really cool and effective sports exercises, what's the point of all that if you don't have a shoulder? You want to squat. You want to put on a bunch of weight on your squat, and then I come up and I say, you know what? You don't really have a hip. And then I ask the person, are hips important for squatting? And the person goes, yeah. And I say, well, what makes you think that you're going to be able to continuously squat and continuously get more and more load and more adaptation if you don't have a hip and your entire squat is being built on a compensation? And how long before that compensation breaks and the tissue compensating for your lack of hip ends up causing problems?